ability to write off the cost of their health care, and we as employees got our health care tax-free. If I'm fired or I quit my job and go into the individual market, I have to buy my health care with after-tax dollars, which, you know, makes a lot of people decide that they don't want to buy health coverage. So I would say in the interim, we need to reform the tax code so that individuals could get their health care tax-free in the same way that we get our health care. But of course, we do make lower wages because when the employer is paying, employers don't have money, you know, taxpayers do. So we make less money, but we get our health care tax-free. I'd like to level that playing field and ultimately over time get rid of that tax exclusion. We don't get our car insurance, our house insurance, our life insurance through our employer, and we shouldn't be getting our health care through our employer. But it's the feds that got us into the mess. So we need to make that change. We need to expand health savings accounts. You know, that about 20-some million people in this country now have HSAs. Employers are even offering them. Puts doctors and patients in charge. People, you know, are more careful when they're spending their own money. As Milton Friedman used to say, healthcare with its first dollar coverage, the 180 million people that have employer coverage, they have no idea what it costs. They think it's free or that little copay, and when people think it's free, they use a lot more of it. So we want to expand health savings accounts. I think people age 65 and over should be able to, you know, continue to put money into their HSAs. I think people should be able to use their HSA money to help pay the premium if they're having a difficulty. So put the doctor and patient in charge. We need to do medical malpractice reform. Remember when President Obama stood up and said this, you know, this little pill, I mean, your doctors are giving people pills, doctors are doing unnecessary testing, and it's very expensive. Because they want to line their pockets with money. Doctors practice defensive medicine because they're afraid of being sued. And particularly neurosurgeons and obstetricians, some of them drop out because they can't afford the premiums unless they're in a large hospital practice. PricewaterhouseCoopers said that cost defensive medicine $210 billion a year. You know, Texas, you know, capped non-economic damages, and they had about 16,000 doctors went back into Texas to practice medicine. We have to, you know, do these punitive damages and non-economic damages, put control in so that we stop all this frivolous lawsuits of an ambulance chasing lawyers going after people. I think we also need to block grant Medicaid, allow people on Medicaid to feel better about themselves, get an HMO. We need to, I think that Trump's, you know, Medicaid work part is a very important part. Why should people decline taking a promotion because they don't want to go off their Medicaid? These people are willing and able to work, and those who are, they should be, you know, not on Medicaid. They should be working their way up the ladder. People should be able to buy their health insurance across state lines. We need price transparency. I think that is a really big issue, and Mr. Trump realizes that it is, President Trump realizes people want to know what things cost, and if they don't know, they can't compare, and American people like to compare. We need to get rid of, you know, and this is an issue in Georgia right now, the certificate of need laws, which keeps new hospitals off the market and helps those hospitals stay in business and make more money. So we need to get rid of those like we did in Florida. So those are a few of the things that are part of my plan to bring about, keep America as the diamond, platinum healthcare system in the world. People do come here from all over the world, not just from Canada, but people from the Middle East come here and get tremendous treatments that they can't get in their own country.
Why is it that Americans still don't trust the free market system? I don't get it.
Well, we were talking about this morning. How is it that socialism is expanding in this country and that young people, young millennials and these people are all thinking the government can do this better? Do they take a look? Do they go to the post office? Do they go to the DMV? I mean, do they look at people in the VA health system? Do they look at people on the Medicaid program? Why? I think it's partly because in the public schools and even in private schools today, children are being taught by teachers and professors who continually say that capitalism is bad, socialism is good, and as Milton Friedman would say, and therefore we need more socialism. So they're being indoctrinated without ever hearing about free market ideas. I founded an organization called the Benjamin Rush Institute back in 2008. It's a sort of comparable to the Federal Society for Law Students. And the idea is to have debates on campuses, because if I go and debate doctors on campuses, medical schools, they're all for government takeover of healthcare, and their students have never heard the alternative. And I'll be talking and debating, and they'll be snickering and laughing because they think that that's all they know, and they think it'll be more efficient, it'll be cheaper, everyone will be covered. They have no clue about what it'll mean for their ability to practice medicine. So we really, there's a huge problem in this country with identity politics, with government taking over everything, and somehow we've got to take that back.
We have, and it's no easy undertaking. I will tell you that.
I know.
Just one last thing from personal experience, if you will. I give the example because people ask me, how's competition going to bring drug prices down? When I was still practicing pharmacy, we had a company come out with this idea of a 30-day supply of generic for $4. I could not even buy generics that cheap. I bowed my back and I said, I'm not going to do that. I can't do that. I can't even buy them that cheap. Well, guess what? A week later, I was selling a 30-day supply of generic for $4.
Right.
I called up my supplier. I said, you got to do something. You've got to help me here.
Right.
I had people leaving. I can't let that happen.
Right.
And sure enough, it drove down the price
prices.
of generics.
Because, and generics, I mean, most people today in America take generic drugs, and they are really reasonable because the original drug has come off patent, and generic drugs in Canada are even way more expensive than they are here. But the FDA needs to quicken up its approval of new drugs and new biologics. They also need to shorten the time that it takes for a generic to get through, because generics are much more efficient, and for many disease, for most people that have like regular sore throats and colds and various things, high blood pressure, high cholesterol, the generics are real copies of the patented drug, and they do work, and they are far cheaper, and that brings down the cost of drugs.
Again, false premise, false promise.
Yes.
A great book, a timely book, a very much needed book. I encourage everyone, if you have the opportunity, to read this. Thank you so much.
Thank you so much. It was terrific, and I hope you are running again and that you're reelected and you'll help the Republicans take back the House so we can get real health care reform in this country.
Thank you. It's been a privilege.
Thank you. Good. Great.
Okay.
This program is